Treatment of diabetes mellitus. Hello and welcome to Mini Medicos. Diabetes mellitus is of two types, type 1 diabetes mellitus and type 2 diabetes mellitus. Type 1 diabetes mellitus is treated mainly with insulin, while treatment of type 2 diabetes mellitus include physical activity, oral hypoglycemic drugs, and insulin in emergency conditions like hyperosmolar coma. Oral hypoglycemic agents work by two mechanisms. Few act by increasing insulin, while other act by other mechanisms. To increase insulin, at least 30% of functional beta cells should be present. Side effect of these drugs is hypoglycemia, while other drugs cause no hypoglycemia and have other side effects. How beta cells secrete insulin? When blood glucose level increases, glucose enter into beta cells of pancreas with the help of GLU2 channels. This glucose is then converted into ATP. Increase ATP level in the cell blocks ATP sensitive potassium channels that increase potassium level inside the cell. This potassium opens calcium channel, and when calcium level in the cell increases, it causes depolarization of cell and secretion of insulin. Treatment. Main treatment of type 1 diabetes mellitus is insulin. Most common route of giving insulin is subcutaneous route. Insulin is also given via intravenous route in case of emergency conditions like diabetic ketoacidosis or hyperosmolar coma. Sites of insulin injection are given in this image. First one is anterior abdominal wall 2 cm away from the umbilicus, upper outer arm, anterolateral aspect of thigh, buttock region. Diet control, it is the first step and carbohydrate is strictly regulated. Exercise, it increase GLUT4 levels and this GLUT4 will promote sugar entry into muscles resulting in decreased blood sugar level. Exercise of about 30 minutes per day for 5 days per week is recommended. Bigonides, they inhibit hepatic gluconeogenesis. Drugs in this group are metformin and fenformin. Drug of choice for treatment in obese diabetic patient is metformin. Fenformin is not used nowadays because of its side effects. Next group is sulfonylureas. Drugs belonging to this class are chlorpropamide, tolbutamide, glipizide, glycoside and glyvanelamide. Thiazolidinediones. This class include pioglitazone and rosiglitazone. Side effect of pioglitazone is bladder cancer and side effect of rosiglitazone is congestive heart failure. Next class is alpha glucosidase inhibitors. This class include ascarbose and volgibose. They act by inhibiting glucose absorption from GIT and their side effect is osmotic diarrhea. Meglitinides include rapaglinide and natiglinide. They increase insulin secretion. Side effect is hypoglycemia. Dipeptidyl peptidase 4 inhibitors include sitagliptin, saxagliptin, and vildagliptin. Most common side effect of these drugs is nasopharyngitis and upper respiratory tract infections. Glucagon-like peptide 1 agonists include zenaglutide, zenatide, liraglutide, and dulaglutide. Most common adverse effect is nausea followed by vomiting. Sodium glucose cotransporter 2 inhibitors include they cause urinary loss of glucose resulting in decrease in blood sugar level. Canagliflozin, dapagliflozin, and artugliflozin are the drugs belonging to this class. Most common adverse effect of this class of drugs is urinary tract infection because they cause glucose loss in urine. Pathology and pharmacology of oral hypoglycemic drug will be discussed in another video. Thanks for watching. Please like and subscribe Mini Medicos.